I'm Gloria Strode and welcome to Straightforward. Today we have a very special treat for you. We are going to educate you on some very important health matters. We have the awesome team members from Renal Associates, Dr. Tamori Smith and Dr. Raj Alapan. Thank you all so much for coming.
Thank you for having us here.
It's time to have that conversation. We have a lot of information we need to cover, and of course Dr. Smith will probably give me some more pointers on some other things later. But first, we just want to share with our viewers the things we should be talking to our primary care physicians about. And if we stay on top of that, then should we have to come to visit your team, then we have a clearer understanding of what's happening with us. Share that with us.
Absolutely. So, you know, obviously we're specialists. So we're renal specialists. We specialize in kidneys and kidney disease. But things don't happen overnight. Kidney disease is a progressive issue, and it's a chronic issue usually. So you've got your primary care doctor, who is your first line of defense against multiple health issues, including kidney disease. So obviously we recommend that you follow up with your primary care physician as they recommend. If you have chronic medical problems, hypertension, diabetes, hyperlipidemia, issues with cholesterol, so on and so forth, then that's something that needs to be monitored at a routine and regular basis, and you need to follow with your primary to do so. That's the person that's going to follow issues and let you know if things are progressing to the point that you do need a specialist.
Wow.
So, of course, you'll have to have your urine monitored. You have to have your diabetes monitored to make sure that you're not spilling protein in your urine. All these things that go toward looking at your kidneys to tell if there's disease that's happening that then may need to be looked at by one of us.
And so the numbers will tell us where we're going.
Actually, Gloria, this is a wonderful forum what you're providing for your audience. What I really want to mention, stress upon what Dr. Smith said, this once the patient goes to their primary doctor and when they start talking about kidney disease, initially they are shocked and terrified as to why they didn't know all along. So the point what we would like to bring forward to you and your audience, who are most of them, some of our patients, we all do go through this when we get older. No matter whether you're a patient or not, kidney function tends to go down.
So that's a part of the natural aging process. Okay.
Absolutely.
Now, when your primary care doctor sees certain indications or pointers that suggests that you are going to have a kidney disease, that is when I think you have to act upon. Don't wait too late, and you can be proactive as a patient. Asking your primary care doctors, how is my kidney? They would say your numbers are good, but they also have to understand that the numbers will be good to a certain extent that you start seeing these numbers, what is called the creatinine. It's a blood test which we do to check the kidneys, indirectly says what the kidney function is. When that number starts creeping up, that means your kidney function is already down.
Really?
We would like to catch these patients or see these patients or make sure they are tested much earlier by doing a 24-hour urine. When you talked about the numbers we're talking about are two things. One is a blood test, which talks about the creatinine. Creatinine is a substance which comes from the muscle, which goes through the kidney and comes out.
From the muscle?
Correct.
Yes.
Oh, okay.
So what we are trying to say is that when you check this creatinine, it reflects what your muscle is. The reason why these numbers are very important is when you get older, our muscle starts reducing in size. When they start reducing,
We're shrinking.
I mean,
I'm waiting on that.
basically what we're trying to say is that the creatinine is an indicator of the muscle. When the muscle is less, the number is less.
Right.
But we take this number and say because the creatinine is less or low, we say kidney function is normal.
Okay.
That is what you have to be careful when you get past 50, 60 up there. When the muscle is less muscle mass, as we call, the creatinine is going to be low. It does not mean that your kidney function is normal.
Oh.
So you need to actually
See, so we're really, I was confused about that.
Correct.
So that doesn't necessarily mean.
Do you think
The creatinine doesn't tell the full story.
Okay, all right.
And-
so
and
it's
so
more
that's
to
what
that
he
story.
means,
the
yes.
point about that is when the creatinine starts going up, that means your kidney function is going down.
That's right.
Okay.
By general rule of thumb, When the creatinine start rising, your kidney function is already down by 50%.
Really?
So we don't want to wait till that long. So it's good for the patient to be proactive and asking the doctor, how about doing actually a 24-hour urine?
So when we get that annual exam, and I'm due for mine with Dr. Lois E. Newman, should I just be asking her, what should I be asking her? Because normally for women, we're looking for the pap smear, the breast, you know, that kind of thing, and we just kind of take it for granted.
What I would suggest is, taking from Dr. Smith's initial comments, when you have a diabetes for a long time, minimum at least 5 years and above, and once you reach 10 years of diabetes, there is always some changes in the kidney. And then you have got a high blood pressure which has not been controlled well.
Right.
These two are the commonest cause for the kidney disease.
Okay.
Once you have this in your medical history, it's always good to ask your doctor, is my kidneys fine? Is my numbers going up or is it still the same? Do you think there is a need to do a 24-hour urine collection to do the kidney function?
So that's something that I should request.
You should
Well, and I
request.
think as a patient, you know what your medical problems are. All patients know what problems they have and
Right.
what they've been diagnosed with. I think it's just important to say, how are my kidneys? Because your primary care doctor is a good doctor, they know what they're doing, and there's oftentimes they're looking at your kidney function, and they know some of the things that we're saying, and so they
Right.
may say in theirs to themselves, okay, I probably need to keep an eye on these kidneys, but not actually saying it to you as the patient because you haven't
Right.
really brought it up.
Okay.
And it's not to the point that you need a specialist as of yet, but your doctor is monitoring it. So
Okay.
as a patient to say, well, how are my kidneys doing? That brings the conversation up. So
Okay.
then your doctor may say, well, you know what? This is what's going on, but I'm keeping an eye on this. That at least lets you know that there may be some issues that you need to be aware of. That way, if you have to see a kidney doctor, that's not the first you've ever heard of it.
Exactly. And I think people, they panic.
Sure.
Correct.
And they immediately think, if I'm seeing the kidney doctor, I'm
Absolutely.
dying.
Absolutely.
I'm so glad you brought
Yeah.
that up. That is the truth. I can't tell
Oh,
you
I
the number
know
of
it
times
is.
patients come to my office for a chronic kidney disease evaluation and they automatically assume, oh my gosh, I'm going on dialysis.
Right.
I do more than just dialysis.
Right.
You know?
Right.
Chronic kidney disease is huge, many more patients. And so it's important for people to know that sometimes seeing the kidney doctor is more of a proactive step so
Okay.
that we can see, assess, and try and help prevent them from going on
going
dialysis.
on the
Because that's our
dialysis.
goal, our primary goal. Of course, that doesn't always happen. People sometimes need dialysis, but the primary goal is to prevent dialysis. Prevention, a pound of prevention, an ounce of prevention is worth a pound of cure.
Right.
There you go.
Right. And so if we're asking our primary physicians to just check that, like we follow up
Absolutely.
with the pap smear and the breast
Absolutely.
exams for women, and then for the men, you know, the PSA and that kind of thing, we just need to ask that question.
Absolutely.
Right.
The primary care, there's one other number which, as we talked about the numbers, what are the things to check for? We talked about the creatinine, that's the blood test. But also in the urine, the primary care is very good at this. They always do this, what is called as albuminuria
Okay.
or protein in the urine.
Right.
Okay.
You start spilling protein in the urine once the kidney is damaged. There, when we talk about the proteinuria, there is one early warning sign is called microalbuminuria.
Okay.
That's a specialized testing for albumin, which is a kind of a protein spilling in the urine. You want to catch this patient at that level, not by the time they come to my office, they already have protein, which I can test with a urine test, what we do in
Right.
the office. We want to catch them early. So diabetics, that is an early warning sign of kidney.
Okay.
One other thing is that diabetes affects the whole body.
Right.
So when these patients come, we need to check with them to make sure they have been to the eye doctor. Make sure they check their eyes to see any changes.
Okay.
Because when they look at the eyes and there are some changes, 85% of the time, there is a good chance that the kidney is already affected.
Wow.
So that's another indicator,
Okay.
you know, of what the kidney is when you check your eyes to make sure that these patients go to the doctors and check about their eye changes, which will also reflect what the kidneys are.
All right.
So when these patients actually come to the primary care doctor and they say you're going to go to the kidney doctors, they get, as you said, they get terrified. They
I
feel
know.
the whole world has fallen apart.
Exactly.
They feel they're going to go on dialysis. That's the first question. Am I
Right.
going to go on dialysis?
Dialysis.
Absolutely.
But it is not. When
Okay.
you catch them early, when you do all the tests that we talked about,
Then we can
we can look at,
and get it under control.
there are three things we can look at it. One, as a kidney doctor, as Dr. Smith and myself are here, when they come to us, when we talk to them, we tell them, we're going to find out what is your kidney level of function. That is what is called creatinine clearance or GFR.
Okay.
We don't have to go much in detail on that.
Right.
But it in simple terms tells you how your kidney is filtering.
Okay.
There is a number we can get, and we can loosely say the percentage of your kidney working.
All right.
And that can be that is classified into 5 different stages. Stage 1 is good. Stage 5 is when you need dialysis.
Okay.
Now, as a kidney doctor, we are not going to do anything other than finding at what level of your kidney function is. Now, at different levels of this kidney function, it causes some issues to the body.
Right.
So we also go ahead and check all those things, what the kidney causes
Right,
to the
and
body.
yeah.
So what are the effect of that kidney function at that level? We need to treat that. Now also we got to go and see why this kidney function went down. We talked about diabetes, we
Right.
talked about blood pressure.
Right.
There are so many other reasons. Now, when we get older, a lot of people actually nowadays live longer.
Yes.
Because of the medical technology.
Right.
And the marvels of medicine.
Right.
So when they live longer, there are blood vessel problems, there are what is called
Just natural
atherosclerosis.
aging.
Aging.
Right.
Basically, it's nothing but blood vessels showing we talk about the cholesterol, blood vessels showing certain what is called atherosclerosis.
Right.
So that will be another one we shall look at.
Okay.
And there are other reasons.
Okay.
So-